Hey there, welcome to another lesson. In this lesson, we are looking at the assessment criteria for the writing subtest. There are 6 criteria in all: purpose, content, conciseness and clarity, genre and style, organization and layout, and language. Purpose takes 0 to 3 points, and the rest of the 5 take 0 to 7 points each. And in the previous lesson, I mentioned that to get a B, you need to get at least a 2 for purpose, and then 5 for each of the rest of the assessment criteria. Let's look at these in detail. Purpose. This depends on the task that you have, and it should be immediately seen. The purpose, the reason for writing the letter should be immediately identifiable and sufficiently expanded. Once the recipient of the letter or the reader takes your letter to read, they should know why you are writing the letter to them. And this is contained in the task that you have. For example, refer so and so patient to the senior nurse, you're given the name and everything, for continuous care. It means when you're thinking about the purpose, which is supposed to be in your introduction, later when you're looking at the format of the letter would go into detail. If you're putting what you want the reader to do for the patient, that should be in the introduction, should be the first thing. Once the reader takes the letter to read, should be the first thing that they see. The purpose should be immediately identifiable. And like I mentioned, it's dependent on the writing task that you're given. So you need to be able to read and understand the writing task for you to know what to put down in the purpose, which comes in the introduction. Usually it would contain the name of the person, the age, the condition of the person, and what you want to be done for the person. Then the next is content. And you need to be able to include all the relevant and key information that you have in the letter. All of the key and relevant information should be contained in the letter, and that is dependent on the recipient of the letter. You need to be aware of the recipient of the letter and think about what they need to know in order to do what you want them to do for the patient. You've stated the purpose of the letter. You want them to take care of the person. You want them to schedule an appointment, or whatever it is that you want the recipient to do for the patient. You need to think about that and ask yourself, if I were the one receiving this letter, what information will I need to discharge my duty? So you think about that to include all the necessary and key information that would help the reader. The content of the letter changes with regard to the recipient. So once the recipient becomes different, then of course the letter, the content of the letter, what is termed relevant, would definitely change. What is relevant to this recipient may not be relevant for the other, especially because they are in different fields and they have different duties and responsibilities. The next one is conciseness and clarity. Just before we go back to conciseness and clarity, think to logically organize and present the key information that you've been able to select. And remember, you're supposed to expand them into complete sentences. So the very primary information which is necessary comes up, then you follow by secondary relevant information. Make sure you don't include any irrelevant information, and that is the focus of conciseness and clarity. Omit irrelevant information and summarize significant ones efficiently and effectively for easy understanding and retrieval of information. Health professionals are quite busy because almost on a daily basis they're dealing with lots of patients, and so they do not have the time to now read a whole lot of information to select which ones are relevant for them. So you need to be able to omit all the irrelevant information. Omit all of the irrelevant information, and the ones that you think are relevant, you should be able to summarize them effectively so that it will be easier for the recipient to understand and retrieve the needed information. To be able to do this, you need to be aware of who the recipient is and the setting. You need to be aware of the recipient and the setting. For example, if it's an emergency ward, your letter would be briefer than if it's a normal admission ward, because at the emergency, of course, they need to rush, so to say, with what they are reading to be able to discharge their duty to the patient so that there's no loss of life. You shouldn't bother about word count at this point, because if you do that, then you'll be tempted to include irrelevant or distracting information. I mentioned in the previous class that you don't have to think about word count, although you've been asked to write approximately 180 to 200 words. Of course, you can come a little below the minimum, or you can exceed the maximum a little bit by about 5%. So do not, just think about, okay, I have just 180 words, it's not enough, and so you may just veer into adding irrelevant information, which wouldn't augur well for your scores. You have 0 to 7 to score at this point, so you cannot afford to include irrelevant information. Then you think about genre and style. What is the purpose of writing? And who is the recipient? Largely, the letters that candidates are supposed to write are formal letters when it comes to the OET. You should think about the purpose of the letter to think about, the register, the words that you're using. Because it's a formal letter, you're not supposed to use note forms. Even that is stated in the instruction that you have. You're not supposed to use bullet forms. You are not supposed to use symbols and shorthand. You're not supposed to use colloquial language. These are informal. These are okay for informal settings. You're not supposed to use the contracted forms as well, because those are suitable for the informal settings. You need to be clinical, you need to be factual, you need to be professional, you need to be formal. Your tone should be appropriate, it should be courteous and polite, it should be professional. It shouldn't be as though you're just chatting with, a random person. As to whether you should include abbreviations or not, depends on the recipient of the letter. If the recipient is within the same medical discipline as the writer, then it's fine to use, abbreviations, because it means that it's common to both of you. But if you're writing to a lay person or somebody in a different medical sector, then you don't have to include abbreviations and medical jargons. Otherwise, they wouldn't be able to understand the information you're giving them. It will be very difficult for them to comprehend and retrieve the information that you have put in there. Let's look at organization and layout. And to be able to score good for this particular criterion, you have to think about the task that you have, the recipient, and the type of letter that you're writing. Am I writing a referral letter? Am I writing a discharge letter? Which means that you should choose suitable structural features. There are some of the features that cuts across. For example, the address, the dates, the salutation, the subscription. These are constant, regardless of what type of letter you're writing or who the recipient is or what task that you have. You think about coherence and cohesion when it comes to organizing, so that the structure of the letter is suitable enough, is appropriate enough for the intended recipient. And even as you're paragraphing, there's a link among the paragraphs that you have. It helps in the retrieval of information. Key information should be clearly and logically highlighted. You think about paragraphing as well. You may want to do the leave a line style of paragraphing, or the indented one. Although organization and layout is a criterion for the assessment of the writing subtest, when it comes to the structural features, the arrangement doesn't matter, so to say. So whether you put the address on the left or on the right doesn't really matter. The features should be there, and they should be logically arranged. You don't put the address somewhere in the body of the letter. That is very absurd and illogical. Okay, so you should be able to logically arrange the structural features as well as the information that you have. Then when you think about paragraphing, are you arranging the information with regard to time frame, earliest, later, the past, or whatever? Or are you looking at priority, what is very urgent, immediacy with regard to what must be done for the person and the information that the recipient will need to immediately take care of the person? Or you're thinking about problem and solution. So these are the problems of the person, or this is the problem of the person, and this is what you're supposed to do for the person. Whatever it is, whichever style you choose, you should be able to logically arrange them. If you're doing chronology or priority or problem solution, all three options are okay. You just need to choose which one would help you to relay the information you're supposed to get to the person in a more coherent fashion. Think about the task that you have. So the task tells you who you're writing to, what the person should do for the patient. You know the recipient from the task, and the type of letter that you're writing to is contained in the task. So write a letter to this person referring the patient to him or her. That becomes a referral letter. Or write a letter discharging so and so to be transferred to another specialist. You know what type of letter you're writing from there. Key information, like I said, should be clearly and logically highlighted, and that is the primary thing you should think about when it comes to organization and layout. Then again, you should think about the features, the structural features of the letter. Let's look at the last assessment criteria, which is language. You should think about accuracy in terms of grammar. And grammar, you're thinking about concord, subject verb agreements, noun pronoun agreements. You are not at one point referring to the patient as a she, and at another point you're referring to the patient as a he. There should be some concord. With tenses, something will have to be done for the patient in the future, or this was a condition the person had in the past. You should be able to use the appropriate tenses, past, present, future, and all the other types to convey the information appropriately. Otherwise, it's likely to impede the understanding of the information that you present. You should think about types of sentences you're writing also. Thinking to combine multiple case notes. For example, you find one and the medical history that correlates immediately with one and the management. You can just put these two together. It would help you to really write a good letter. Then think about vocabulary as well. You should be able to have a wide range of vocabulary. Your word choice should be appropriate to the recipient, to the based on the type of letter that you're writing. Think about synonyms and paraphrase versions as well. Think about synonyms and paraphrase versions as well. So you look at the case notes, try not to use the same words which have been used, paraphrase them. It shows that you're proficient in the language. And you may have to reorder some of them also, because the case notes are usually note forms or bullet forms. You have to think about reordering to get so that no part of the sentence that you have is dangling. You need to sometimes change word formation, probably change it from a noun to a verb and all of that. No informal words I've mentioned, no informal words and expressions. Check your spelling. Check your spelling, it's very key. It may lead to a misunderstanding with regard to the information that you've put across. Think about punctuation also. Appropriacy is more important than range of linguistic features. I've talked about all of these, but bear in mind that appropriacy, how appropriate what I have talked about is more important than range of linguistic features. So you're not trying to, broaden the range of, let's say, words and expressions, structure, tenses, and whatnot at the expense of appropriacy. That shouldn't happen. Again, none of the factors I've talked about, grammar, vocabulary, and all of that, none of them must impede the reading and comprehension of the information by the reader. At the end of it all, you are communicating with the reader. And in this case, although the intended recipient is, let's say, a social worker, it is the examiners who are going to read. And of course, they are specialists. And so definitely they would be able to tell how relevant, for example, the information that you've put in there is, or how irrelevant it is. Think about the assessment criteria as you write the letter, because those are what the examiners those are what would inform the examiners with regard to the scores that should be given at the end. of everything. A C plus is accepted by some governing boards and councils, but to get a B, you need to get 2, a minimum of 2 in purpose, and 5 for content, conciseness and clarity, genre and style, organization and layout, and language. All the best with your practice, and see you very soon in the others. I hope this helps you so much in your preparation, because I'm looking forward to receiving all the good news from all of you. Stay blessed.